So you may have seen that Randy Moss, who is an NFL star who I grew up with. Obviously, I didn't grow up with him in terms of playing with him at all. You know, I'm from Odessa, but we played football there. But I never played football at the level that he did. He was recently taken a leave of absence because he got diagnosed with biliary cholangiocarcinoma. And I want to talk about this particular topic because it's an important topic for my patients, but also it's relevant because it's on the news right now. He's recently revealed on an Instagram live that he got diagnosed with cholangiocarcinoma or bile duct cancer. And this is a very, very, very uncommon cancer. However, in my world, we see this commonly just because I see the uncommon things that are not usually seen in the general public. So what exactly is bile duct cancer? So the bile ducts are literal pipeways that go from the biliary system, the gallbladder, and the liver, which eventually will drain into the small intestine called the duodenum. And these are ducts that are little pipings that allow bile to go through and other nutrients that you need to help you to digest. In some of these areas, you can have abnormal cells that are developing, which in turn can lead to cancer, what's called bile duct cancer or cholangiocarcinoma. That's the medical term for bile duct cancer. And this is exactly what Randy Moss was diagnosed with. Now, Randy Moss reported that he just felt like things weren't right, but also he reported that he all of a sudden developed what's called jaundice or yellowing of the skin. And this is the typical presentation of a cancer in the bile ducts. So those bile ducts actually carry bile from the liver and it allows it to go where it needs to go. And when you have a blockage of those ducts, very similar in your plumbing, when you have a blockage, you have a backflow of everything going beyond that blockage, proximal to that. And that typically in the bile ducts is bile. So when bile presents as a blockage and it goes into your bloodstream, it'll present to you and to like Randy Moss as yellowing of the skin or jaundice. And so he noticed that his skin was jaundice, his eyes were jaundice, and this was the first time that something else was going on. Now, there are other symptoms that can present with this as well, things like fatigue, nausea, weight loss, abdominal pain, especially on the right side, pale or chalky stools. These are symptoms that when you see this and you couple that with jaundice, absolutely it makes you worry about something wrong that's going on inside your body. In fact, when I see somebody who has what's called painless jaundice, when all of a sudden they are yellow, they don't have any reason why, this is absolutely a medical emergency because what I worry about first is there a cancer that's there? And this is also why it's very important to be cognizant of these symptoms, especially your stools, because this can also present as pale colored stools. When you have a blockage and that bilirubin goes into the body, it's not going to your stools. You're not digesting it. And it's that bilirubin that will give the stools the brown color. And so you don't have that bilirubin, your stools become more chalky, more white, and pale colored as well. And so for Randy Moss, this was actually the first time that he noticed something bad was going on. What did Randy Moss do next? So obviously we don't have the specifics on that, but if I see somebody like this, we'll get imaging. Absolutely, we'll do either a CT scan, an ultrasound, or what's called an MRCP, so we can see exactly what's going on. But in addition to that, we'll get blood testing as well. And those blood testings, we can check cancer markers, but we also can see if the bilirubin is high and what else is going on. And so I'm assuming this is what they did for Randy Moss. And so when they did this, they probably saw something suspicious going on in the area where the bile ducts were at, where the gallbladder could be, but also where the liver is as well, because this is also a sign of other cancers besides cholangio or bile duct cancer. So Randy Moss stated that he underwent what's called a Whipple procedure, which is a surgical procedure in which you actually remove part of the intestines to remove the area that's cancer that's there. Now, the treatment for this will depend on the stage. So, if there's cancer somewhere in the bile ducts, we have to remove that cancer. So for some individuals, we'll do chemotherapy, we'll do radiation, we'll do surgery, or we may do other things as well, depending on the stage of that cancer. So the Whipple procedure, which is a very particular procedure, is where you move part of the small intestine, the gallbladder, part of the ducts, and rearrange it to hopefully get that cancer out of there. Now, it's a pretty intense surgery. It can take up to 6 to 9 hours to do, but it's a very common surgery that we do in a lot of individuals that have cancers like this. So even though it is a long surgery, in the right hands, it is a very effective surgery to hopefully remove the cancerous area, but it'll allow you to get better treatment for what's going on inside your body. And with this surgery, you're removing part of the bile ducts, part of the pancreas, some of the liver, and also rearranging the small intestine as well. So currently Randy Moss is on medical leave from his work at ESPN. Obviously, we wish Randy Moss the best that we can. We want to give him the best wishes as well. And also want to make sure that he has a speedy recovery. And hopefully they caught this cancer early, where you can have a full recovery as well. The main point I want you to be aware of, some of the signs that you should be aware of when it comes to a cancer like this.